And caregiver disease series, starting off with Alzheimer's disease. So, very good for caregivers to know some information about their clients' diseases. Alzheimer's disease, very common and increasing daily. What exactly is Alzheimer's disease? Well, here's a definition here. Progressive mental deterioration that can occur in middle or older age due to degeneration of the brain. It is the common cause of premature senility. So, Alzheimer's disease falls underneath the dementia syndrome. So, dementia is considered a syndrome. And then symptoms of that syndrome, of that dementia, are Alzheimer's disease, along with other neurodegenerative diseases. However, Alzheimer's disease is number one. The number one symptom of dementia is Alzheimer's disease. It's around 64% of all dementia is going to be Alzheimer's disease, and very good information here that is kind of bringing this all together. Very difficult to understand what causes Alzheimer's disease. They think there's a genetic link, and you can see what it does to your client's brain here, right? Normal brain is expansive, it's kind of lit up, and it's working normally here. Alzheimer's disease affecting the brain, you see how it shrinks the brain here. It kind of darkens the neurological connections in the brain. Kind of looks like dark spider webs inside of the brain, and it's actually shrinking the brain matter when you look at an Alzheimer's disease affected brain. And it's almost like there's little lights in your brain and somebody is slowly turning off those lights on a daily basis. Okay, so Alzheimer's disease has three main stages. Some people break them down into seven main stages, but mild, moderate, severe would be stage one, stage two, stage three. Signs and symptoms you're looking out for in stage one would be the mildly forgetfulness, repeating sentences, maybe can't finish a simple sentence, forgetting keywords, those types of things would be stage one. And then it's just about progression, right? Stage two, it gets worse and worse and worse. Stage two, they can actually start to forget family members, their own name. And then stage three, final stage of Alzheimer's, they can have seizures. They can be stuck in bed. They forget their own personal history. Interesting how recent memory goes first. Like they might remember their childhood, but still have recent memory. And this whole process of going through the three stages can take many, many years. Can take 5 to 20 years from diagnosis until the end. And they're going through the three stages here for Alzheimer's disease. Now, what is happening in the future for Alzheimer's disease? I think the future is going to be all about prevention. So, in other words, slowing down the stages. When we first recognize Alzheimer's disease, what is the best combination of treatment, medication, using AI to help our clients through our days? They have washrooms where it talks to a resident, it talks to a client that you might have, tells them to enter, how to use the sink, how to use the toilet, walks them through that whole process. Of course, I think the robots are going to play a big role in the future, assisting uh, people with Alzheimer's disease. This is kind of just showing you detection is key, right? The sooner you can detect a person has a higher chance at Alzheimer's, the better you can treat it, right? So it's all about diagnosing it, getting that prognosis into the AI system, and that's going to kind of benefit a person through the treatment strategies. So living a longer, healthier lifestyle without the loss of personal activities on a daily basis. That's going to be what it's all about. Okay, so AI is going to help with that in the future to try and slow down or control this disease. Good. Hope that was helpful. See you next time on JoJo the Caregiving Show.